As the world's leading optics company, Carl Zeiss looks back over a long history of experience in developing aspheric lens concepts and solutions for a variety of products and systems. Carl Zeiss has managed to literally capture the zeitgeist of a technological era. For more than a century, Carl Zeiss has defined high-level quality, unparalleled optical expertise, and outstanding innovation in optical technology. It therefore comes as no surprise that Carl Zeiss has now, for the first time, applied this proven technology to a new generation of aspheric IOLs used in cataract surgery, introducing the first members of the new Zeiss Optic ZO family, the XL Stabi ZO and the Invent ZO.
Hi, my name is Damien Gatinel. I am an MD, PhD at the Rothschild Foundation in Paris, France. I am currently involved in the clinical evaluation of the ZO concept IOLs. The quality of vision depends on many parameters: optical aberration, transparency of ocular medias, contrast sensitivity, and light sensitivity. When we age, there are many changes that occur in the eye. The geometry of the crystalline lens is modified with age. It becomes more spherical and the gradient of index of refraction is modified. The balance between the corneal and crystalline lens aberration is disrupted. Therefore, there is a positive increase in the total amount of positive spherical aberration. Restoring the ocular metropization is not the only goal for the IOL implantation. We should also bring the eye back to the optical quality that it had in the past. Many studies conducted in pseudophakic patients have shown that the spherical geometry of an IOL is not the optimal geometry. Spherical IOLs induce positive spherical aberration, and this adds to the corneal spherical aberration. And this, in turn, results in a loss of contrast sensitivity, especially for mesopic vision conditions and large pupil diameters. Aspherical IOLs have been designed not to induce positive spherical aberration, or even to compensate the positive spherical aberration of the cornea.
The advanced optic of the Zeiss aspheric lens is, among other aspects, patterned after the Liu and Brennan eye model.
The Liu and Brennan eye model has been recognized as the most anatomically accurate model, in that it takes into account physiological issues such as the eccentricity of the fovea, as well as the fact that the optical axes in the eye are not perfectly centered with respect to each other.
To ensure accurate realization of image quality, the Zeiss optic relies on the modulation transfer function.
The maximal contrast visual acuity is not enough to control the optical quality induced by an aspheric IOL. If we want to specifically assess the optical quality of an IOL, we should look at the modulation transfer function, the MTF. The MTF can be simply calculated using a referent aberrometer. It is simply the ratio between the contrast of the object and the contrast in the retinal image. When looking at the MTF curve, we see the result of the combination of all the high-order aberration that affect the eye after IOL implantation. The MTF is probably the best metric to both evaluate the visual acuity and the contrast sensitivity after cataract surgery. The MTF considers that any image we see is made of spatial frequencies. In this way, low spatial frequencies correspond to gross details in an image. On the other hand, high spatial frequencies correspond to fine details. Improving the contrast sensitivity over the low and medium spatial frequencies may be important, especially for elderly patients.
In developing its aspheric lens concept, Carl Zeiss has brought together the best of both worlds in combining the advantages of negative spherical aberration lenses and aberration-neutral lenses. The unique ZO lenses enable reduction and control of the spherical aberrations of the eye, while at the same time showing very low sensitivity to decentration and tilt. The ZO lenses are preloaded in their cartridge to allow for easy, sterile, and reproducible application. Simply clip the cassette into the disposable injector. The lens is protected at all times to avoid risk of damage, manipulation, and cross-contamination. Most importantly, the patient safety is further reinforced as the complete procedure is greatly simplified. Patients experience a more comfortable operation, while surgeons have more time to devote to the care of their patients. For more than 10 years already, the hydrophilic acrylic IOLs of the Carl Zeiss have successfully demonstrated its excellent long-term behavior on the market in terms of biocompatibility, transparency, and stability of the visual function and centration. A foldable and highly adaptable implant for all bag conformations, the Zeiss IOLs display outstanding tensile strength for maximum resistance during insertion and offer controlled unfolding for fast visual recovery. To optimize the contact surface with the equator of the capsular bag, as well as to secure postoperative stability, the XL Stabi ZO and Invent ZO feature a 3 and 4 haptics design respectively. The flexible haptics are optimized to fit bag retraction while securing long-term centration.
When I think about the ZO concept, I think it's a very neat one. Firstly, it uses a very pertinent metric to assess the optical property of the pseudophakic eye, the MTF. Secondly, the design of the ZO IOLs has been made using a sophisticated eye model, the Liu and Braden ocular eye model. Thanks to these properties, I think the ZO IOLs can be used routinely.
Thanks to their innovative aspheric concept, the ZO lenses, Invent ZO and XL Stabi ZO, outperform conventional spheric intraocular lenses by improving the quality of the image and restoring high contrast sensitivity for the largest range of spatial frequencies, even in difficult visual situations such as low light conditions. The shape of the posterior optic is optimized to provide minimum sensitivity in optical performance with respect to decentration and the tilt of the implanted IOL. Thus, a high degree of reproducible and precise refractive outcomes is ensured. By mimicking the spherical aberration of a young, healthy, phakic eye with slightly positive aberrations, ZO lenses deliver superior vision quality and the best image quality the retina can process, while preserving the depth of field.